So there have been a lot of anecdotal reports of parents, complaining about these problems, these gastrointestinal problems going on with their kids. And from my understanding is a lot of times it's been dismissed. So there hasn't really been a systematic way of looking at the problem. So what we found was that children with autism and children with developmental delay were at least 3 times more likely to have a GI problem. Okay, and we had at least 10 GI problems that we were asking parents about. Anything from diarrhea to constipation to abdominal pain and so forth. And that saying that they're at least 3 times more likely is a conservative estimate. Okay, it can really range up to 12 times more likely depending on the GI symptom. Our first major finding was that children with autism and developmental delay do indeed have more GI problems. So that validates what parents have been saying for many years now. Okay. The second major finding that we found was that GI problems are occurring more frequently, but those are associated with the problematic behaviors in children with autism. So there's a connection. Kids who have more GI problems are having more behavioral problems. And traditionally, we have thought of those two things as very separate things. So now we can start to address better, more appropriate treatments. If we find an underlying GI problem, it could potentially, if we treat that, it could have positive effects on the behavior. For a lot of parents, it will validate what they've been saying for all these years, that there's something going on with my child. And hopefully now, physicians will pay closer attention to that. So I think validating what the parents' concerns have been is a big step forward. So now we can actually start to look at, okay, well, we understand that kids with autism have more GI problems. What's causing this? Why is that? So that's really the next step we'd like to take it to. The American Academy of Pediatrics recently released some recommendations on how to treat GI symptoms in children with autism and developmental delay. So the hope is that pediatricians will take that information and familiarize themselves with those guidelines and share that with their patients and their families.